The Supreme Court in April 2023 has given a judgment that how well we can live. Before that, there were a lot of jargons with the medical system. So, when you should stop treatment, when you should continue the treatment, when who are the decision makers in your family, or see, when you're not in a position to sign or talk or anything, there should be someone to take decision on your behalf. So, for that reason, you need to have one set of document which is called a living will. So the living will mentions the documents saying that you have your name on that, your address and your personal choices and what your life will be and what your treatments are. So for that, we have to think like how are we going to support at that point of time. So most of us wanted to die at home in our own way. So a living will is just a document in which you wanted to write your own wishes. So how should we pass dying? Abdul Kalam. No, all deaths should not be like Abdul Kalam's death, right? He was talking in a class, giving a presentation or a meeting. Suddenly he had a cardiac chest pain and he collapsed and died immediately. That is like comfortable death, but not all deaths will be like that. Let me reintroduce myself. I'm Dr. Raju, lead consultant for Sparsh Hospice in palliative care. So today the topic which I'm going to discuss will be on advanced directives and how well we are going to live during the next course of our journey. So this concept is completely new into the Indian scenario, and the legality parts and those are the things which I'm going to brief you over the next 30 to 40 minutes. So what it is, what is a living will, what is an advanced directive will, when we have to take that, when is the time to start talking about that. So over the next 35 minutes, I'll be just discussing you, and it will be an interactive session. It is nothing like a medical talk or anything. It is an interaction between everyone, and you can ask your questions and I can let you know at that point of time. So I'll start my presentation. So advanced medical directives, the Supreme Court in April 2023 has given a judgment that how well we can live. Before that, there were a lot of jargons with the medical system. So when you should stop treatment, when you should continue the treatment, when who are the decision makers in your family, or am I alone do all those things. So with that, the latest guidelines have come up and will be over the next. So we are at digital dances, but not too far behind in community. But last 4 decades, there is a lot of evidence in the last 4 decades, and I opportunistic about the future. So we should plan our future. Should we during the terminal? You have a lot of confusions. So if you get a fever or something, you go to the hospital, get treated, come. But there are some chronic related sufferings, health related sufferings, in which to take your decision about if be in the hospital or stay at home, continue the quality of care, and that is what you have to come up with a plan in your life, right? And because we are evolving in a rapid manner, being before we used to have a lot of people to take care at home, a lot of family members. The family dynamics has changed, and what can you or I do? So when we plan a trip, why should you plan how you want it to live? Generally, when we start planning trip during our childhood days, when we go for a trip, we just go randomly to all the places. Like if I'm planning to travel from Hyderabad to Goa, now during the phases of life will be there, right? During your college days, you just randomly go on a road trip and all those things. But as you advances over the next few months or years time, so you start planning your trip before. Where do you want to stay? How you want to plan your trip? How do you want to travel? All those things you start planning. The same way for our life, as we age or progresses, once you cross like 50 years or 60 years, so we have to plan ourselves. So how well we want to live, and These are the things which we have to plan that. Think of the last journey of the life. The destination is fixed. Everyone, as a human being or as a being need to leave the world at one point of time. So how beautiful the journey should be. We should think of it and then we have to plan accordingly how it is. So what your experiences of your last illnesses to be like? Should you be on a hospital bed with a ventilator, tubes, and all those things, suffer with some IV lines and all those things? These are the things you need to plan. So to plan all those things, you have to have how you want it to be on a piece of document. See, when you're not in a position to sign or talk or anything, there should be someone to take decision on your behalf. So for that reason, you need to have one set of document which is called a living will. So the living will mentions the documents saying that you have your name on that, your address and your personal choices and what your life will be and what your treatments are. So as we progress in this changing world, this is the literature from which it is there. So one person in household will have the single family member to take care, either your daughter or a son. Right now, this is a 2011 census, which shows that the percentage of household, one person household in India is just a 5%. So as you evolve over the next few years' time, so we might be more bigger than Hong Kong or United States or Japan. So for that, we have to think like how are we going to support at that point of time. So most of us wanted to die at home in our own bed. But in reality, as an intensivist during COVID times, when I saw there were a lot of upper middle class, the most affluent people, the so-called celebrity status and all. They Jagrants with them, their family members, because of societal pressures and all. They wanted to be admitted in the hospital. Your hospital resources are also getting utilized at one point of time. So during COVID, we have seen a lot of people who wanted beds, the younger, older, like it is not about the age discrimination or something like that. During COVID times, there were a lot of upper middle class or affluent families. They used to get the bed for them. But do they really need that bed? No. Because of that social stigma, their children or wanted them to get admitted in hospital, and the resources were not utilized in a proper manner. So who really need the admission and all, they couldn't get the hospital beds, and there were a lot of financial constraints and all those things that happened during the process of COVID. So this all could have been helpful when they have written a living will, they wanted that to happen. So generally 90% of us in the population wanted to leave the world at our own homes with the loved ones around. But in reality, 70 to 80% die in the hospitals. So how to prevent all those things from happening? That is a living will. It is a medically advanced directives. So it has a set of documents. So a living will is just a document in which you wanted to write your own wishes. So how should we pass dying? Till 40 to 50 years of age, generally they doesn't have a lot of suffering other than cancer patients. Remaining people, if you see, they won't have a lot of suffering when they die. They have a sudden death. If you see Abdul Kalam, no, all deaths should not be like Abdul Kalam's death, right? He was talking in a class, giving a presentation or a meeting. Suddenly he had a cardiac chest pain and he collapsed and died immediately. That is like comfortable death, but not all deaths will be like that. So what is a good death? Good death, you have to know when the death is coming and to understand what can be expected. So there are three components in a good death, like how we should leave the world at the end of our life. So to know when the death is coming, we have to understand. Then we should have a time to say goodbye and control the time, to be able to leave when it is time to go and not to have a life prolonged pointlessly. There is not a good death. You prolong your death and you have a lot of suffering. Anyway, you are going to pass your phase of life. So you have to control your timing and have to say goodbye at appropriate time. So you're psychologically, emotionally also you're much better. The next thing is you have to have a good privacy. You have to control the dignity, privacy. So you have to choose and control over where the death occurs, in whose presence it occurs. And you should be able to issue advanced directives, ensure that one's wishes are respected. You should have your own respect, right? So for that reason, you should have a living will or an advanced directive. So you'll have a good death during the end of life. And the next thing is it is a pain relief and other symptom control. So your pain can be different ways in which pain can be there. It need not be only the physical pain. There is an emotional pain, spiritual pain, and psychosocial pain. So to mitigate all these sufferings, we should have a problem. That is where palliative care plays a major role in creating a good quality of life with which can help in your serious health related sufferings. So pain is one of the component along with the pain. If you see Sparsh Hospice as such, we have a lot of patients who are not having any treatment they can't cure. That is where we care for them and they come move here and all. Because there are few organizations in Hyderabad, if you look into that. So all this, we don't treat the patient, we just care for them. We have psychosocial, emotional connect, all those things we try to do. There are few people who wanted to fulfill their wishes during end of life and all those things. Generally, the hospital scenarios won't support all those things. That is where we do that. Then the next is why the deaths are happening in the hospital and why we should need all these things to happen. In our family or how we grew during the childhood days evolved over the last few years. When there is a birth, people start talking about birth. But the major problem in Indian scenarios is we never talk about death. When any death happens also, we as parents to our children, we don't take children near the death. We generally go. But death and birth are something we don't know when it happens and when it comes. So we have to plan it accordingly. The major problem here is there is a taboo of death. So we won't talk about death. My father will not express his last wishes or whatever it is because he thinks that no, these are not going to happen practically. There are a lot of things and the way he grew and all those things. So we are not talking, not willing to talk about death, lost opportunities for last wishes, last opportunities for life reviews, like emotional setting of accounts. We will never plan. So who should take what property? That is the reason where there are a lot of disputes that are happening in Indian scenarios. So our law doesn't permit parents, patients and families to take control, but now the law legal systems are changing rapidly. Doctors are scared of making decision to withdraw the fetal care. As a doctor, if you see 5 years or 6 years back, when I was working in intensive care unit, but we were always aggressive. We know that patient is going to pass away, but we give all sort of treatment, either because we are afraid of the medical legal systems or we think that the family will start suing us in the court and the legal system is much hierarchy. The default option is we generally continue till the bitter end. We have poor access to the system that controls suffering at the end. So example, if you see morphine is the medication for a physical pain. So as a professionals, none of the doctors, most of the doctors in the present scenario doesn't address the total pain. The concept of total pain is just not about the pain. If you get a headache, generally the doctor thinks that there is some amount of issue in his brain or something like that. Over the you have repeated pain and all. But the concept of total pain is like you treat in all the 4 components of pain. Either it is a physical pain, emotional pain, social or a psychological pain, or spiritual pain. If you see the cancer, there can be a pain from the disease as such. The second thing can be a psychological or a social pain that can happen because of the person that he or she had cancer and they always think, is it going to cure and all those things. That is amount of psychological distress they have. It is a form of pain. So all these 4 components should be addressed with care. So we as a palliative care physicians, we think of all this total pain. Palliative care is just not a medicine, it is more than a medicine, which we also deal with psychological, emotional, and spiritual aspects. So now you should think of your last journey of your life. So we plan the last journeys of our life. So how do you plan it? So who has this information? When I am on a ICU bed or something like that, I am not in a position to take my decision. So we should clearly write in the document who has that information, who is your surrogate maker, and who is planning your next treatment. The surrogate decision makers are the persons on your behalf who are responsible for the plan and to implement all the things. So the next thing is, I am a doctor. So the patient expects us to prognosticate them. Like we should foresee before itself, like how are they going to progress over the next. As a patient, you come to the doctor, you go to the doctor to get it treated and cured. So you expect. So generally, I'm just giving an example of cancer scenario. So generally, what happens is once they are diagnosed with the cancer, most of the patients doesn't get cured or recovered anything. But as a doctor, we should foresee and foretell them. We should tell you're like this, you're going to progress like this, and that is what. But most of the doctors doesn't prognosticate. They just tell you continue the treatment. So whatever the conversations are happening, we should be honest, accurate, and optimistic about this. But these all three things make us a very difficult thing to understand for the people as well. This can be a difficult. So what we face in a regular scenarios as it is a thing, when your near and dear ones during their last stages of life, or they be in an ICU with tubes inside all the cavities like nose, mouth, and all, taking artificial breathing on their. Generally, we say this is a Telugu word like nothing chappodu. That is what generally the families will tell to the doctor during the conversations we have. And even the doctors are not competent enough or skilled enough to do bad news and all. So there is in medical curriculum, the way in which communication should be delivered, there is no training like that. So the doctors were always into the physical mode of those things. Communication is one of the key major things that builds a rapport with the family members. And patients, families, communities needs to understand that honesty is really a best policy. You be honest, whatever it is. As a family member, what is your expectations from them and what he wanted and this is. So depression, anxiety worsens with concealments and coercion. Till we reach the stage that doctors are willing to tell and their patients are willing to hear. So it should be a mutual way in which it should happen. So as a doctor, I should tell him I should prognosticate the condition. I should tell the family members that how he is going to progress with this particular disease or anything like that. So when there is an advanced directive will in place, or we call it as a living will. So whatever wishes are there. So the decision maker will also have the option. There are few members who come to us and tell, sir, they have already returned the living will and they wanted us to be comfortable. They don't want any suffering. You can give them comfort. Who has the information? Most doctors policy, don't ask, don't tell. Like until they tell or ask you, you should not tell. But as a doctor, we should give them the indication that when you go for this treatment, this is what it happens. These are the advantages, like disadvantages or whatever things those are there. You should think of it, and it is not always the doctors forcing the family members to do all the things. It is the mutual way in which it should happen. So who should plan your last journey? It is you or someone you trust or default mode when nobody plans for this. So always my opinion personally is you should plan your last journey. So this is what it should happen. So it will be easy for everyone. So more than easiness, it is the comfort, like how you were. So generally, if you see the elderly people in our family, they won't have any living will or anything. You aggressively treat them and all those things. They recover from that. After that, they come and they say, I suffered a lot. They don't have quality of life. Every time they are suffering, they are bedridden and all those things. The worst suffering happens when there is nobody able to talk to them or willing to make decision. There will be a lot of jagrons in the family. So this is the most suffering for everyone, the family members, the caregivers, as well as the patient as such. So all these people are suffering. So they don't have their will in place. So they start suffering. So all these sufferings, palliative care is one component in which we can minimize. If you can speak coherently, you decide and your choices, and then the decisions come first. So the moment you decide, that will have all those things. So whose responsibility is it to plan? It is definitely we as an individual should start planning our life how it should be. Can you decide? Yeah, definitely we can decide. So right till the end of life, we can plan how it is and what it is. So when should we plan an advanced directives? What is the advantage of having an advanced directives? Once you lose the decision of making your decisions in making capacity, when you are in an hospitalized position and all those things, typically that is when you should start making an advanced directives or a living will. Once the dying process begins, it can be from hours to days time. So that is one scenario. If you see cancer, it can be days to weeks before the death. When there is an organ failure, it can be days, weeks, and months. When you have an dementia, it's like memory loss and all those things, your death will be prolonged, but your quality of life will not be as good as it is. So this is one. So this is one of the major terminology that is used by doctors and the court of law in the living will scenario, which is called an autonomy. So, autonomy is nothing but you have the right to determine your own future, like to accept or decline any therapies, to decide who decides for you as well. So, the autonomy is this absolute? Is it really valid in India and how it is? This concept has been from the Western world, but in India in 2023 April, the Supreme Court has given a verdict that your advanced directives can be will with lot of change. Before that, in 2018, there were a lot of rules. You should go to a magistrate, be in front of them, document all those things. There was a lot of hiccups in that. So in 2023, the Supreme Court has given a verdict that you can have your own advanced directives, sign it on an 100 rupees stamp paper with a surrogate decision maker, like your family members who can take your decision on your behalf or as an representative from your side, and you should submit this paper in the local panchayat office. So these are all the new changes that happened over the last 1 year.